Hello and good evening to everyone. My name is Kore, and in this evening, I'm going to present to you the topic which was entitled Announcing Informatic and HealthCare Policy. But before we jump on this topic, let's have a word of prayer.
Dear Heavenly Father, we thank you for gathering all of us today. May you bestow your guidance and blessings so that we can enjoy and appreciate its significance in our lives. Bless everyone who are present here today, that each one of us may be able to share our knowledge, understanding, and wisdom for your glory and honor. May the various activities related to this event be a success through your intervention. We all ask of this in the mighty name of Jesus. Amen.
Moving to our learning objective for today. Up to the completion of this topic, the learners will be able to discuss some of the significant impact of federal registration, which started from 2009 and 2020, and they will also be able to discuss on the use of health informational technology. Upon also completing this topic, the learners will be able to describe the creation of the Office of the National Coordinator of Healthcare Informational Technology, and they will also be able to summarize some of the major roles that they play in the implementation of health informational technology. Upon also completing this topic, the learners will be able to discuss some of the implication policy announcing informatics as specialty. Upon also completing this topic, the learners will also be able to identify some of the impact that national trend and event focused on informational technology. We also be able to outline some of the role of health IT or health informational technology. So let's now first of all discuss on some act which was being released in 2009 of health informational technology for economic and clinical health, which was being abbreviated as HITECH. The HITECH Act was passed as the part of American Recovery and Reinvestment Act of 2009. And this act was aimed to promote the adoption and meaningful use of electronic health record by healthcare providers and organizations. And this act also provides the funding for electronic health record implementation, infrastructure development, and workforce training in order to support the adoption of health informational technology across the healthcare industry. Moving to the impact of HITECH Act on healthcare, we see that there is a several impact of HITECH Act that has been significant on healthcare. Some of the key impacts include increased adaptation of electronic health record. Secondly, it also improves the patient safety and quality care. It also facilitates in health information exchange, and it also promotes a health analytic and population health management. So let's now try to break down each point. By starting on the increased adaptation of electronic health record, we see that the HITECH Act incentivizes the healthcare providers and organizations to adopt and use of electronic health record by providing a funding for those health electronic record implementation and meaningful use. And this have also led to a significant increase in adaptation of electronic health record across the healthcare industry. Moving to the second point, which is improved patient safety and quality care, the use of electronic health record has been shown to improve patient safety and quality care by provided by the healthcare providers. Electronic health record now have been allowed those healthcare providers to access patient information quickly and easily, and have also helped them to reduce the risk of medical errors that usually occur, and it has also helped them to improve some clinical decision making. While moving on the third point, which is facilitated health information exchange, we see here that the HITECH Act promotes the interoperability of health information system, which make it easier for healthcare providers to exchange health information securely and efficiently. And this also has made an improvement in care coordination and led to a better patient outcome. While moving to the fourth point, which is promoted health analytic and population health management, the use of electronic health record has made it possible for healthcare providers and organizations to collect and analyze the management of health data. And this have also enabled the development of population health management strategy in order to improve the health of communities. Moving to the significance of Medicare and Medicaid electronic health record incentive program, this program have also been known as a meaningful use program. This program were established as a part of High-Tech Act to incentivize the healthcare providers to adopt a meaningful use of electronic health record in their practice. And the program were designed to encourage the healthcare provider in order to move away from paper-based system and adopt electronic health record, which improve in return the quality and coordination of care. So the significance of Medicare and Medicaid electronic health record incentive program is that they provide a financial incentive for eligible healthcare providers who adopt a meaningful use of electronic health record. The program also, those eligible healthcare providers who have been adopt and meaningful use electronic health record have been received an incentive payment from the centers of Medicare and also Medicaid services. And the Medicare and Medicaid electronic health record incentive program have also been successfully in promoting the adaptation and meaningful use of electronic health record. According to the CMS, as of 2021, they say that more than 19% of eligible hospitals and 80% of eligible healthcare providers have received the incentive payment under the program. The program have also helped to improve the quality care and coordination care provided by healthcare providers in this way. Electronic health record have allowed the healthcare providers to access patient information quickly and easily in order to reduce some of the risk of medical error that usually occur and also to improve a clinical decision making. Aside from that also, the program have facilitated the health information exchange and make it easier for healthcare providers to share patient information securely and efficiently. Moving to the Patient Protection and Affordable Care Act of 2010, which was also known as Obamacare, it's a federal law that was there to improve the access to healthcare and also to reduce a healthcare cost in the United States. And this law was being signed by the President Barack Obama in March 23, 2010. Okay, moving to the Office of National Coordinator for Health Information Technology. The Office of National Coordinator for Health Information Technology was being created in 2004 by the executive order in order to promote the adoption and use of health information technology in healthcare. And this Office of National Coordinator is a division of the USA Department of Health and Human Services. And this Office of National Coordinator has played a major role in implementation of health information technology in healthcare, which include implementation of electronic health record and also promotion of health information exchange between healthcare providers. Some of the key roles and responsibilities of Office of the National Coordinator include development and promotion of health information technology policies and standards. Secondly, coordination of health information technology activities and oversight of electronic health record certification. Let's now starting by defining or by discussing the first point, which is development and promotion of health information technology policies and standards. The Office of National Coordinator develop and promote a policy and standard in order to support the adoption and use of health information technology in healthcare. And this included the development of the standard and the interoperability framework, which was provided the guidance on health information technology standard and implementation specification. Moving to the second point, which is coordination of health information technology activities, the ONS coordinate health informational activities across the federal government, such as effort in promoting the health informational technology adaptation and use in healthcare. Moving to the third point, which is promotion of HI, the ONS promote HI between healthcare providers to improve care coordination and patient outcome. And this includes the development and promotion of nationwide health information network, which provide a secure platform for sharing health information between healthcare providers. So, looking on some examples of ONS include standard and interoperability framework, nationwide health information network, meaningful use and health ID dashboard. Moving to the impact of policy on nursing informatics as a specialty, the policy has a significant impact on nursing informatics as specialty, as it creates the regulatory environment in which a healthcare organization must operate. So the nursing informatics professionals are now responsible for implementing the health information technology system that comply with relevant policies and regulation. And this play a crucial role in ensuring that health information technology systems are designed to meet patient needs and also to improve healthcare outcome. And some of the ways in which this policy impact nursing informatics include compliance, standard, funding, and also quality improvement. Once we try to break down each point, looking on the first point, which is compliance, the policy initiative has created a requirement that nursing informatics professionals must follow to ensure that health information technology systems comply with the relevant rules and regulations. For example, nursing informatics professionals now must ensure that the health information technology system comply with Health Insurance Portability and Accountability Act in order to protect patient privacy and security. Moving to the second point, which is standard, the policy initiative has also often established a standard for health information technology system, such as the technical specification required for electronic health record. And nursing informatics professional now ensures that a health information technology system meet those standards in order to ensure the interoperability and exchange of health information across different systems. Moving to the third point, which is funding, policy initiatives have also provided the funding for health information technology initiatives such as Medicare and Medical Aid electronic health record incentive programs, which made now nursing informatics professionals to have a responsibility for applying the funding and also for implementing the health information technology system that meet the requirement for reimbursement. Moving to the fourth point or the last point, which is quality improvement, we see now that the policy have initiated or have driven the quality improvement effort in healthcare, such as the Joint Commission on National Patient Safety Goal, where nursing informatics professionals have the responsibility for implementing the health information technology system that support quality improvement effort and also help the organization to meet a quality standard. Moving to some of the examples policy initiatives that have been influenced in nursing informatics, we see that it includes Joint Commission National Patient Safety Goal, Institute of Medicine Report on the Future of Nursing, Health Insurance Portability and Accountability Act, which is abbreviated by HIPAA, and also a meaningful use. And once we try to break down each examples of policy, We see that Joint Commissioner National Patient Safety Code. We see here that the NPSG are there as a set of standards that remind a healthcare organization to ensure or to meet the patient safety. While the Institute of Medicine report on the future of nursing recommend that nurse should play a leadership role in transforming healthcare, including the use of health information technology in order to improve patient outcome. When moving to the third policy, which is being abbreviated by HIPAA Act, we see that the HIPAA is a federal law that regulates the use and the disclosure of protected health information. Here, the nursing informatic professional ensures or have the responsibility to ensure that the health information technology system comply with the HIPAA regulation in order to protect the patient privacy and security. While moving to the last example policy, which is meaningful use, as mentioned earlier, this meaningful use program provides the incentives for healthcare providers in order to adapt and also to use electronic health record that meet with a certain standard. So here nursing informatic professional, they play a key role in implementing this system by also ensuring that they meet a required standard. Moving to the national trend, an event that focuses on information and information technology, we see some significant impact that have made on nursing informatic practice. And some of those impacts include the growth of telehealth, implementation of electronic health record, use of mobile health technology, artificial intelligence and machine learning, and also big data and analysts. Once we try to break down each point, by starting to the first point, which is growth of telehealth, telehealth refers to the use of technology in order to provide healthcare services which are done remotely. And during the time of COVID-19, we see that this use of telehealth have been accelerated, which have made the nursing informatic professional to adapt quickly in order to implement this technology and also to ensure that the patient are receiving the high quality care. Moving to the second point, which is implementation of electronic health record. The implementation of electronic health record has also transformed the healthcare delivery and improved the patient outcome. We see here nursing informatic professionals who have been used as an instrumentary in implementing electronic health record and also in ensuring that it is being designed to meet patient needs and also to improve healthcare outcome. While moving to the third point, which is the use of mobile health technology, the mobile health technology such as mobile apps and wearable devices have made a potential to improve patient engagement and also to support a safe management of chronic condition. Here we see now nursing informatic professional having the responsibility for implementing this technology and also to ensure that it also designed to meet patient needs and also to improve health outcome. While moving to the fourth point, which is artificial intelligence and machine learning, we see that the artificial intelligence and machine learning have made a potential transformation to the healthcare delivery and also in improvement of patient outcome. Moving to the last point, which is big data and analysis, we see that the use of big data and analysis have made a potential improvement of healthcare delivery and support a population of health management. Moving to the law of health IT in emerging payment and clinical practice change initiative, there are several examples of how this health IT have played a crucial role in this initiative. And those examples include Medicare and Chief Reauthorization Act, which was being abbreviated as MACRA. The MACRA was there also to have a name or a goal to shift a healthcare payment from traditional fee for services to value-based care. The health IT play a crucial role here in MACRA implementation by enabling the capture and also by reporting the quality measure through electronic health record. Moving to the second example of health IT that have been playing a crucial role in this initiative, which was being abbreviated as CMS, or Centers for Medical Care and Medicaid Services. We see that the quality payment program was being designed in order to incentivize the high quality patient care and outcome through payment adjustment based on the performance. Here, the health IT have made a critical program success by enabling the providers to track and also to report the quality measures, and also by supporting the development of clinical decision support tools and other resources which improve the care. Moving to the third point, which is patient-centered medical home, which was being abbreviated by PSMH, and accountable care organization, which was being abbreviated as ACO. The PSMH and ACO model care was there also having a aim to improve patient outcome while reducing costs. And the health IT play a crucial role there in this model by enabling the collection, analysis, and also sharing of patient data across the care setting in order to support care coordination and population health management. While moving to the fourth one, which is telehealth and remote patient monitoring, which was being abbreviated as LPM. Telehealth and LPM technology are becoming also increasingly important for improving patient access to care, reducing cost, and also enhancing care coordination. And here we see a health IT playing a crucial role in enabling those technology by supporting the secure exchange of patient data between providers and patients. While moving to the last point, which is blockchain technology, we see here blockchain technology as something that are making a potential revolution to a healthcare by enabling the secure and also by decentralizing the storage and sharing of patient data. We see here that health IT professionals are exploring the potential application of blockchain technology in order to improve patient privacy, patient data security, and interoperability. Moving to our take-home or summary for today, we have seen that there is some federal registration such as high-tech and APCA that have made a significant impact on the use of health information technology and electronic health record. And you have seen also that ONS, which is termed as the Office of National Coordinator of Health Information Technology, playing a major or a crucial role in the implementation of health information technology. And you have also seen that the nursing informatics as specialty, it's impacted by policy initiative like the Joint Commissioner National Patient Safety Goal and the Institute of the Medicine Report, which was being abbreviated by IOM. I've also seen that there is some national training and event that focus on information technology, which have made the growth of telehealth and also the implementation of electronic health record, which in return have made an impact on nursing informatic practice. And you have also seen that the health IT are playing a crucial role in emerging the payment and also clinical practice change initiative such as Medical Care Access and Chief Reauthorization Act, which was being abbreviated by MACLA. This is the reference that I use. Thank you for listening and continue to have a blessed day.